All oxygen-sensitive cells respond immediately, and we see immediate improvement in the balance of neuromediators in the brain. We see very fast improvement in cardiovascular functions. We see capillary growth, bone healing accelerated. We see improvement of blood delivery, improved iron utilization, improved lactate utilization. We see anti-diabetic effects. We see hormonal improvements. We see facilitation of stem cell-dependent tissue repair. So these are not all results of this simple intervention. Okay, now to theoretical field. As Aubrey postulated, 7 main components of aging process, they are all modulated by combination of hypoxic and fasting treatment. Recently, 8 reason was found, 8 reason, nuclear pore aging, and it's connected to oxidative damage to nuclear pore. I cannot say that it prevents all the 7 or 8 reasons, but it modulates favorably all these 7 reasons. Details you can find in this publication. I published it in 2007 in attempt to explain exceptional longevity of bowhead whales, mammals that live more than 200 years and they don't have cancer. And they have special, their way of life combines regularly fasting. They fast 6 months a year in winter time. And of course, continuous hypoxic training, because otherwise they cannot survive. Okay, what mechanisms are involved? Most of these mechanisms are linked to nitrous oxide production. They are mediated by nitrous oxide. What mechanisms? They are typical classical mechanisms which influence regenerative processes and protection of genome. This is enzymes, glutathione peroxidase, superoxide dismutase. These are chaperones as SHP17, and these are all typical pathways which result in cardioprotective, vasoprotective, neuroprotective, and anti-stress defense. There are many other pathways. I even cannot cite, I cannot quote literature because there are too many. It's a big list. If you are interested, you will find detailed description in this monograph, Clinical Applications of Intermittent Hypoxia. It will be published in the next month. And this monograph, which includes our chapter on the longevity enhancing interventions. And it will be available at the end of 2009. Well, technically, medical applications of IHT, they are summarized in this list. It's a result of biomedical research of several decades, and there are thousands of publications in Russian, English, and German. This is the list of typical problems which can be alleviated and sometimes cured with this intervention. My own experience corresponds to the clinical studies and observations. Since 1998 till 2006, it was about 102 patients treated, and the cure rate, I would say cure rate up to 70%, up to 88%, and the improvement, dramatical improvement and alleviation rate is about 70 to 80%. Interesting case you can find in my poster presentation. Technically, how it is done. These machines produce oxygen-reduced air and oxygen-enriched air. This is a small device for private use and for small practice, and there are machines for professional use, can serve simultaneously up to 5 persons. Important, IHT is essentially not a medical intervention. It can be described as a training. Therefore, there are less regulatory problems, if any. On the other hand, these devices are in several months they will be registered as medical devices. We started this program about 2 years ago, and now we deliver this treatment through established providers. We deliver lectures, provide educational seminars, and in the last year we opened 6 centers in Germany and 3 in Mallorca. 2/3 of our clients are seniors. And without any advertising, the demand is constantly growing. Again, quoting Aubrey, I think that we are on the way to test a prototype of a rejuvenative facility which provides affordable rejuvenative treatment. And during this time I learned a lot from my patients and from my experience, and most important lesson was this: people don't care how much you know if they don't know how much you care. Thank you for your attention.